Echoes of a pandemic, a new virus emerges in China. The world watched in early 2020 as a novel coronavirus emerged from Wuhan, China, capturing global attention and concern. This virus rapidly evolved into a global pandemic, affecting millions and altering life as we knew it. The COVID-19 pandemic served as a stark reminder of the interconnectedness of our world and the vulnerability of human health to infectious diseases, highlighting the need for global cooperation. Now, in late 2024, China faces another surge in viral illnesses, sparking concern and prompting a proactive response from health authorities. This new wave of infections has put the world on alert once again. This new outbreak, while different in nature from COVID-19, underscores the importance of vigilance, preparedness, and global cooperation in the face of emerging health threats. It serves as a crucial reminder that the battle against infectious diseases is far from over. Just as the world began to breathe a collective sigh of relief with the decline of COVID-19 cases, new reports from China have emerged, indicating a significant rise in respiratory illnesses. This has reignited fears and concerns among the global community. This recent uptick in cases has raised concerns about the potential emergence of novel pathogens and the possibility of another pandemic. The world is watching closely, hoping to avoid a repeat of the past few years. However, unlike the initial uncertainty surrounding COVID-19, scientists and health officials have been able to quickly identify the primary culprits behind this new wave of infections: Human Metapneumovirus, or HMPV, and Avian Influenza. These viruses, while known, have shown a worrying increase in cases. While these viruses are not new to the scientific community, their recent surge in China has sparked a wave of concern and prompted a swift response from Chinese health authorities. Measures are being taken to contain the spread and protect public health. The world is watching closely, haunted by the specter of the COVID-19 pandemic and hoping that this new outbreak can be contained before it reaches a global scale. The memories of the recent pandemic are still fresh, and the stakes are high. The coming weeks will be critical in determining the trajectory of these viruses and the effectiveness of containment efforts. The global community remains vigilant, ready to support and respond as needed to prevent another widespread health crisis. A surge in respiratory illnesses, decoding the culprits. The recent surge in respiratory illnesses in China is a stark reminder of the ever-present threat of infectious diseases. Hospitals are seeing a notable increase in patients presenting with flu-like symptoms, including fever, cough, and shortness of breath. This surge has placed a significant strain on healthcare systems, particularly in major cities where the number of cases is highest. While the initial wave of infections caused widespread concern and speculation, health officials have been able to identify the primary culprits behind this outbreak: Human Metapneumovirus, or HMPV, and Avian Influenza. These viruses, though not new to the medical community, are known to cause respiratory illnesses and have sparked a renewed sense of urgency in containing their spread. The identification of these viruses has allowed for a more targeted approach to treatment and prevention. However, the situation remains fluid, and health officials are closely monitoring the situation to track the spread of these viruses and assess the effectiveness of current containment measures. The coming weeks will be crucial in determining the severity of this outbreak and the potential impact on global health. The world is watching closely, hoping for a swift and effective response to prevent a repeat of the devastating COVID-19 pandemic. Human Metapneumovirus, or HMPV, a closer look. Human Metapneumovirus, or HMPV, is a common respiratory virus that infects people of all ages, but it is especially prevalent in young children, the elderly, and individuals with weakened immune systems. First discovered in 2000, HMPV has quickly become recognized as a significant cause of respiratory illness worldwide. HMPV typically causes mild, cold-like symptoms such as runny nose, cough, and fever. However, in severe cases, it can lead to more serious complications, particularly in vulnerable populations. Infants and young children may develop bronchiolitis, a potentially life-threatening infection of the small airways in the lungs. Older adults and individuals with underlying health conditions may experience pneumonia or exacerbations of pre-existing respiratory diseases. Currently, there are no specific treatments or vaccines available for HMPV. Treatment primarily focuses on alleviating symptoms, such as using over-the-counter medications to reduce fever and congestion. In more severe cases, hospitalization may be required to provide supportive care, such as oxygen therapy and mechanical ventilation. The lack of targeted therapies and preventive measures underscores the need for continued research and development to address the global burden of HMPV. Developing effective vaccines and antiviral treatments will be crucial in mitigating the impact of this virus, particularly in vulnerable populations. Section 4. Avian Influenza, a looming threat. Avian influenza, commonly known as bird flu, refers to a group of viruses that primarily infect birds. These viruses are found naturally among wild aquatic birds worldwide and can infect domestic poultry and other bird and animal species. While most avian influenza viruses do not infect humans, certain strains such as H5N1 and H7N9 have the potential to cause severe illness in people. These strains have been responsible for numerous outbreaks and fatalities over the past few decades. The recent detection of avian influenza cases in China has raised concerns about the potential for human-to-human transmission and the possibility of a wider outbreak. This situation has prompted health authorities to increase monitoring and implement preventive measures. Avian influenza viruses typically spread through contact with infected birds or contaminated environments. This includes direct contact with infected birds, their droppings, or surfaces contaminated with the virus. Humans can become infected through direct contact with infected birds, their droppings, or surfaces contaminated with the virus. This is why handling birds with protective gear and maintaining cleanliness is crucial in preventing the spread. Symptoms of avian influenza in humans can range from mild respiratory illness to severe pneumonia, acute respiratory distress syndrome, and even death. Early symptoms may include fever, cough, sore throat, and muscle aches, which can rapidly progress to more severe conditions. The threat of avian influenza lies in its potential for genetic mutation and reassortment. These genetic changes can occur when the virus replicates, leading to new and potentially more dangerous strains. When avian influenza viruses circulate in animal populations, they can undergo genetic changes that allow them to jump the species barrier and infect humans. This is particularly concerning in markets where different species are in close quarters, increasing the risk of cross-species transmission. Furthermore, if a person is co-infected with both an avian influenza virus and a human influenza virus, these viruses can exchange genetic material, potentially creating a novel virus with pandemic potential. This reassortment can lead to a virus that is easily transmissible between humans. The recent avian influenza cases in China highlight the importance of surveillance, early detection, and rapid response. Health authorities must remain vigilant and prepared to act swiftly to contain any outbreaks. Monitoring avian influenza viruses circulating in bird populations and implementing strict biosecurity measures in poultry farms are crucial steps in preventing the spread of the virus to humans. This includes regular testing of birds and maintaining high standards of hygiene. Additionally, developing effective vaccines and antiviral treatments for avian influenza remains a top priority for global health security. Research and development efforts are ongoing to create vaccines that can protect both birds and humans from this potentially deadly virus. Section 5. China's proactive response, a race against time. In the wake of the COVID-19 pandemic, China has adopted a proactive and stringent approach to containing the spread of these emerging viruses. The country has learned from its past experiences and is now more prepared than ever to tackle such health crises head-on. Learning from the lessons of the past, Chinese authorities have implemented a multi-pronged strategy that includes enhanced surveillance, rapid testing, and targeted containment measures. These strategies are designed to be comprehensive and effective in mitigating the spread of the virus. One of the key elements of China's response has been the establishment of a new monitoring system for pneumonia of unknown origin. This system is a crucial part of their strategy, allowing for the early detection of potential threats. This system allows for the early detection and investigation of unusual respiratory illnesses, providing a critical window of opportunity to act before the situation escalates, enabling health officials to quickly identify and respond to potential outbreaks. This rapid response capability is essential in preventing the spread of the virus. This system is designed to act as an early warning system, allowing for rapid response and containment of any potential outbreaks. It serves as a frontline defense against the spread of infectious diseases. In addition to enhanced surveillance, China has also ramped up its testing capacity for both HMPV and avian influenza. This increased testing capacity ensures that the virus can be detected quickly and accurately. Rapid and accurate testing is essential for identifying infected individuals, tracing their contacts, and implementing isolation measures to break the chain of transmission. This is a critical step in controlling the spread of the virus. Rapid and accurate testing is essential for identifying infected individuals, tracing their contacts, and implementing isolation measures to break the chain of transmission. This is a critical step in controlling the spread of the virus and implementing isolation measures to break the chain of transmission. These measures are crucial in preventing the virus from spreading further. Furthermore, China has not hesitated to implement targeted lockdowns and travel restrictions in areas where clusters of cases have been identified. These measures, though disruptive, are necessary to contain the virus. While these measures can be disruptive, they are seen as necessary to prevent the widespread dissemination of the viruses. The public's cooperation is essential in making these measures effective. They are seen as necessary to prevent the widespread dissemination of the viruses. The public's cooperation is essential in making these measures effective. The Chinese government is committed to a zero-COVID approach, employing strict measures to minimize the spread of the virus. This approach has been instrumental in keeping the virus under control. China's proactive response to this new wave of viral illnesses demonstrates a commitment to safeguarding public health and preventing a repeat of the COVID-19 pandemic. Their efforts are a testament to their dedication to public health. The world is watching closely, as China's actions will likely serve as a model for other countries grappling with the threat of emerging infectious diseases. Their proactive measures could set a new standard in global health response.